Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
This is Richard Jacobs with the Finding Genius Podcast. My goal here is to find the exceptional people in their fields, not just the run-of-the-mill people that have been licensed, but the ones that really go above and beyond and are, what I call the geniuses of their field. So I have Dr. Sherif Hassan. I think he definitely qualifies. He's an international physician from Washington, D.C. with a focus on precision medicine. Means he incorporates integrative medicine with genomic mapping, traditional as well as nutritional and lifestyle management. It's geared to the individual patient. So he's also a keynote speaker, and we're going to go into his approach to sleep medicine. So Sherif, thanks for coming.
Thank you. Thank you for inviting me, Jacob.
Yeah, tell me about your work in sleep. What first got you interested in it?
Well, actually, I'm trained as a critical care physician from the UK. I used to work in heart transplant unit up in Newcastle upon Tyne before I moved over to the US. So I have been working in intensive care unit, managing patients pre and post transplant on ventilators. So I'm quite familiar with assisted respiration. And once I came here to the US, because of that, I had an interest in working with sleep medicine and sleep disorder.
Okay. What kind of sleep disorders particularly fascinate you?
Actually, the most common one is obstructive sleep apnea. So I do a lot of studies in that, my office. But my interest goes beyond that. I don't stop at treating the patient with sleep apnea and that's it. It's very important to follow up because sleep apnea and in specific and in general sleep disorders affect the whole body. Especially when it comes to the cardiovascular system. And the interest here in that cardiovascular disease is the most prevalent and yet the most preventable non-communicable disorder. So there is a lot of interaction here between the sleep or the brain and mind and the heart. So that's is the main focus on my work and my interest in sleep medicine.
So within the world of obstructive sleep apnea, some people are doing like airway evaluations to see the shape and, the airway. There's of course CPAP, there's oral appliances. Where are you finding your niche? What's some of the new or unusual things you're investigating within the world of sleep apnea?
I'm very interested in following up of patients after they had the corrective measures, whether by CPAP or BiPAP machines or a dental appliance. Because so far, it's very poorly understood the outcomes after they get treated, in the sense that if they regain the weight, what is going to be their morbidity or mortality ratio. It's very poorly understood how much of hypertension or disorders of the blood pressure they would regain after treating sleep apnea if they gain the weight again. It has been established by studies that metanephrine and the metabolic products of adrenaline and noradrenaline are still there in the urine after getting the patients on CPAP and BiPAP machine, especially if they get told, oh, everything is fine, you have no problems now, and they ignore or disregard the symptoms coming on or creeping on again very slowly, especially with the snoring. Because what happens usually with very mild sleep disorders in the form of the ones that do not need sleep assisted device like a CPAP or so, they get told, oh, they got to open up their airway, they got to use some sort of expanders on the nose to open up their ears so that they breathe properly. But indeed, that snoring can progress to a lower HEI.
Snoring can progress to what?
If not properly diagnosed early on, they can think of the snoring as just being mere snoring without another element of sleep apnea while having a lower AHI.
Oh, AHI is the apnea hypopnea index. So,
correct.
okay, so is snoring itself a hypopnea or is snoring just snoring? And what is a hypopnea versus an apnea? Apnea is like complete cessation of breath, but
For
what
a
is
few
hypopnea?
seconds. But hypopnea is just basically a lowered threshold of breathing, which results in hypoxia and drop of the oxygen concentration in the blood.
Okay, so hypopnea is just, I guess, restricted breathing, and snoring probably classifies as. Is snoring a low-grade hypopnea? Does it cause that? What's the interface there?
It can be associated with low-grade hypopnea.
Okay, I see what you mean. So,
and again, it can be positional or non-positional.
Oh, meaning if you sleep on your back, you snore, but on your side you don't, or same thing with apnea.
The side, yeah.
Okay, yeah. Well, I have definitely positional apnea and snoring too, but yeah. Okay, so I know what you mean. Like for me, if I'm on my back, it's bad. If I'm on my side, it's okay. Okay, gotcha. So, all right, what are you trying to figure out then? You're saying that people that snore, has anyone studied the progression of snoring? Like, do you characterize the volume of the snore, the frequency of the snore, the roughness of the snore? Like, has anyone looked at that?
To the best of my knowledge, no. But the very is being done recently is actually correlating sleep disorders, particularly sleep apnea, to the heart and what happens there, especially now with the evolution of genomic medicine and how that is linked all together. It's fascinating, actually, to have a deeper look into that.
Okay, well, let's focus there. So what have you discovered so far? I mean, when you have an apnea, obviously the heart is affected. What does the heart do? Does it accelerate, beat faster, trying to circulate blood to get oxygen? I mean, what does it do?
Well, the very interesting thing is that it has been noted that there is a circadian oscillation in the heart cell. About 10% of the heart genes oscillate in a time of day dependent pattern or a manner depending on their wake-sleep cycle. And that affects the heart contractility. It in turn affects the blood pressure and the variability of the heart rate, especially during sleep, whereby people who've got a disturbed sleeping pattern, they tend to have lesser dip in their blood pressure and heart rate during sleep, which affects their mortality actually in the long term.
Well, okay, so what happens to the heart? Does it contract harder during the apnea, or after you've had apnea for a period of time, does the heart change, and does it contract harder normally or not as hard?
It contracts hard initially as a normal compensatory mechanism, but in the longer term, the heart muscle hypertrophy, it becomes thickened, and eventually it results to weakening of the heart muscle and heart failure.
Oh, okay. So apnea at first will cause the heart to contract harder, and that will pump up the heart muscle, will build it up and make hypertrophy. Sorry, I couldn't say the word. And then hypertrophy, why does that weaken the muscle? Isn't hypertrophy a sign that the muscle has gotten stronger or just bigger? Does it change the morphology of the heart where it's harder to pump the blood for some reason because you have this fatter muscle?
Yes, exactly. Here is what happens. I meant the muscles increase in the heart muscles increase in size and in number, but it outgrows the blood supply to it. That's why it becomes weaker. So you have an excess of non-functioning or properly functioning muscle cells.
That's interesting. I wonder how preferential the heart is to itself. If it feels like it's not getting enough blood, does the heart say, well, I'm number one, I want this blood, so maybe it pumps harder to try to get more blood to itself? Or does it, does it seem to have any allegiance to itself? Or, is it just working in concert with the rest of the body? Or is that like a heart researcher question?
Yeah, it has a preference to itself because remember, when we're sleeping, the whole body is resting, except relatively for the heart muscle. I meant when you're awake, your heart rate is 70, but when you go to sleep, it's 55. But the skeletal muscles, as an example, hardly work there. So definitely the heart has a preference to bring blood supply and oxygen to itself. And it's interesting that the heart muscles regenerate by a ratio or a percentage of about 0.5 to 5% per year. And this is good news because it shows that to a large extent, the pathological changes or the negative changes that happen there are reversible if we follow the proper treatment and lifestyle changes as well.
What about the interplay between fat around the heart or, through the heart and hypertrophy? Like, the people that have fat deposits in their heart, does that increase hypertrophy? How does it interact with it? And how does it interact with the heart function as well? Do you look at that?
When we say hypertrophy, we mean the lean heart muscle itself, but the fat around it can be affected by other disease. Among them is hypothyroidism, as an example, or amyloid disease. If you mean fatty degeneration of the muscle, that happens in very, very, very late stages of heart failure.
Oh, so do people, for the most part, not have fat deposits around their heart? Their hearts are pretty lean, or no?
Yes, it doesn't happen except in very late stages of heart failure for it to be observed macroscopically or on looking on it with the naked eye, not under the microscope. But again,
Okay, got it.
Yeah.
Well, the reason I was asking is if it could be observed, then maybe there would be an interplay, People with apnea that have fatty hearts versus people with apnea that don't have fatty hearts, but it sounds like it doesn't correlate right now. So that's fine. Okay.
Yeah, the interesting correlation is actually about the weight changes that happen in correlation with sleep apnea and cardiovascular changes. I mean, the incidence or prevalence of heart disease, then the high blood pressure, coronary artery disease, and peripheral vascular disease too. This is much more well established.
So the heart regenerates a little bit each year, which is good. Again, apnea appears to cause this hypertrophy, and then the heart essentially starves itself in some part, so it can't contract as hard. So what happens then? Like, what does the progression do to people?
When it doesn't contract as hard, it's not able to supply the body systems with enough blood, and that leads to upsetting the whole body systems. There is increase in the sympathetic nervous activity. There is increased inflammation in the body. There is increased oxidative stress. There is metabolic dysfunction with more insulin resistance. There is more hypercoagulability of the blood, more endothelial damage, more atherosclerosis, more heart arrhythmias, and onset of sudden or unexplained death too.
All right. So what are you looking at it from an intervention standpoint or just a observational, like this is what happens standpoint? Like, what's your end goal here?
No, I'm looking at it from an observational point of view.
Okay, but how would this inform you on, it's one thing to say, all right, apnea is worse than we thought, let's say, or here's what it really does. But then what do you do with that? How do you make an intervention to help people more than they're being helped right now?
It is to influence the lifestyle in addition to treating the sleep disorder, whether it's by a dental device or a CPAP or BiPAP machine, and help the body to form more nitrous oxide, nitric oxide, because this is what gets the vessels to vasodilate, helps more with the oxygen delivery to all parts of the body system, especially that it is not a specific organ-dependent chemical. It's produced by all cells of the body.
Okay. So, keep going. So what's the implication of that?
The implications of that, when you supply when you're able to make the body form more nitric oxide, there is more vasodilatation, more delivery of oxygen to every cell in the body, which helps to reverse a lot of the changes that happen with apnea and hypoxia.
So how about in training a little bit of nitrous oxide in the air supply of a CPAP? Would that be beneficial, you think?
I'm not aware of this being implemented or even possible. What I meant is to increase the nitric oxide production by the cells of the body.
Well, I know that that's been looked at quite a bit for athletes and for a lot of things, for high blood pressure. But how would you do that? Or how has science already come? There's supplements people take, but I don't know if they're effective. I mean, I know the nasal passages produce a bit of nitrous oxide versus the mouth. So if you're a nose breather, you may be better off than a mouth breather. But how would you get the body to produce more nitrous oxide?
By giving actually the essential substrate in the form of vegetables, things like celery, spinach, lettuce. There are antioxidants also that help, like using vitamin C, E, as well as glutathione, supplements like L-arginine and L-citrulline, as well as exercise itself. And the interesting thing is the role that the oral bacteria and the microbiome play in that. Because giving antibiotics or even using mouthwash on regular basis affect nitric oxide production, because you're affecting the assimilation of nitric oxide in the cells from this basic nutrients.
So, what kind of correlation has been observed with, frequent mouthwash users or people that have, disease like periodontal disease? I'm sure that changes their oral microbiome.
Yeah, it has been shown actually that people who have got dental disorders or use antibiotics or antimicrobials or repeated mouthwash or got poor oral hygiene, that the nitric oxide production is less. Especially that when they have sleep apnea or they're using a CPAP machine, they mouth breathe already, so they're affecting their microbiome. They're not like the nasal breathers whereby this is avoided altogether.
So have there been studies on mouth breathers versus nose breathers, and how does their oral microbiome differ?
The oral microbiome is different definitely between both groups, in the sense that the oral microbiome in mouth breathers is unfavorable for the production of optimal amounts of nitric oxide.
Actually, what about that's interesting. I wonder what happens to the nasal microbiome as if you're a mouth breather for a period of time. I mean, I guess you're not a nasal breather because the nose is clogged. So, I don't know, maybe it goes from aerobic to anaerobic bacteria preferentially because, there's no air going through there. I just wonder what happens. Have you seen any studies that look at the nasal microbiome?
Actually, there are some studies, but the data are not solid there exactly into what type of relationship. But what is clear that there is a difference in that between nasal breathers and mouth breathers.
All right. So is your research, again, solely focused on the heart? Or, it sounds like you're aware of a lot of things going on, but, what specific things are you trying to figure out right now through your work?
Actually, what I'm trying to do is come up with a program to optimize sleep and cardiovascular health, in the sense that if we can make the regular individual sleep between 7 and 8 hours a day, that's the proper amount of sleep to optimize not only their cardiovascular health, but the hormones and the basic function of the body. Because when we sleep, there are certain hormones and certain chemicals that go out in our body at specific times. So if we apply the principle of going early to sleep and waking up early, combining that with proper lifestyle changes, nutrition, and exercise, I think we're going to positively impact the individual patient's health, not only the sleep disorder, the patients, but actually the regular apparently disease-free individuals as well.
Okay. I mean, for people that, they may be in the bed 7-8 hours, but they're, again, because of apnea, the 7-8 hours are, completely fragmented. What can they do? I guess just get the typical treatments, right? The CPAP or oral appliance, and then try to get that 7 or 8 hours that they need and go from there? Or is there an order of things that you would suggest to people?
Yeah, definitely we got to address the sleep disorder, whether it's sleep apnea, whether it's interrupted sleep, disordered sleep, if it is hypersomnia, if it is idiopathic hypersomnia, or because of something else like Klein-Levin syndrome or what, but after you manage that with the proper follow-up, of course, you would really need to address these other ancillary approaches.
Okay. So what do you think is in store for the future of sleep science in the near term, in the next few years? Any big changes coming, or just a better understanding, characterization?
Yeah, I'm actually pretty interested by the evolution of home sleep studies, and now you have the newer versions of the machine that transmit data wirelessly, so it can be used for monitoring as well. Gathering up this data and incorporating it with machine learning protocols might be the way of optimizing one's health, in the sense that you're going to reduce the incidence of cardiovascular disease and other diseases as well. And using digital health applications like chatbots, and so you're able to educate the patient on demand.
Okay, educate them on demand. I mean, as they're using a CPAP, for instance, or just in the beginning before they get into any intervention, or when do you think would be the best time?
The best time to use it, of course, during the day, whereby you can deliver to them information about the disease, the sleep disorders, how it interacts with the different body systems and organs, approaches for them to improve their sleep hygiene, their eating habits, control of other associated ailments as well, like the high blood pressure, the cardiovascular disease, the diabetes that happens there. In addition to associated ailments, I meant something like, as an example, GERD or acid reflux. It's not a straightforward sleep disorder, but definitely if they have that through the night, it's going to affect their sleep, resulting in an interrupted sleep pattern, which throws off their sleep cycle, in the sense that they don't have enough of deep sleep. Their sleep becomes interrupted. It's more of a REM sleep, which is not sufficient to revitalize and rest the body. So it helps us to understand the patient as a whole, not only being restricted to the sleep apnea or the sleep disorders.
Okay. Well, very good. So, Sherif, what's the best way for people to find out more and to observe your research and, ask questions about it, or at least learn? Where should they go?
Actually, I'm working on a product. It's a digital health product under the name of Luana. The website name is luana.health. They can get in touch with me over there to go over what we're doing regarding addressing the whole body health through looking at it through an integrative approach, especially when it comes to sleep, because this is a chatbot application that is going to integrate with several sleep monitoring methods like the Oura Ring, and we're going to gather the data there and provide the patient with an application that they can use, not only to manage their sleep, but their overall health, and prevent the most prevalent and preventable disease, which is cardiovascular disease.
Well, very good. Well, Sherif, thank you for coming on the podcast. I appreciate it. It's just amazing all the factors that go into what apnea does, and all the things to consider. So it's good that you're looking at these aspects of it. So thank you.
You're welcome. Thank you so much for inviting me. I appreciate it.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.